Good morning, everybody. The NHS is, I think, an international icon of the British social conscience. It's designed to replace fear with hope. It's owned by the people, for the people, funded by everyone, for everyone, irrespective of their age, social status, race, or creed. And a principle which is as important today as it was in 1948. But since then, the world has changed quite dramatically. We now have more older people in this country than we have children. Longevity brings with it its own set of ailments and diseases of old age, which add a level of complexity. So the needs and expectations of the elderly population are different to the needs and expectations of a younger population who demand immediacy of access, information, and treatment. And on top of this, medicine has become much more advanced. It's become more complex and more effective, but importantly, it's also become more expensive. So we're now gripped in the quadruple pincer of increasing demand, escalating costs, a set of rising expectations, all in a constrained financial environment. Our NHS, I believe, has coped very well with this. While other countries have slashed services and salaries, we've remained absolutely true to the founding principles of the NHS. Over the last 4 years, we've squeezed the orange on efficiency pretty tightly, and patients and staff have felt that, I think, on a daily basis. So we need to find new ways of doing things, or quality will suffer, deficits will emerge, waiting times will creep out, and we may have to introduce restrictions on new treatments. Bevan noted that discontent arises from a knowledge of the actual versus the possible. We don't want to open up that gap, and we certainly don't want to open up that debate, and it doesn't need to be the case. We can manage the demand on the simple premise that prevention is better than cure. We can increase efficiency through greater use of new technologies, new models of care, and supporting people who want to and are capable of self-care. But it's going to be difficult. Our NHS, though, has a remarkable track record. As the biggest semi-integrated healthcare system in the world, we've addressed a number of challenges over the last 65 years, and I think now we've reached a point where we can take a giant leap forward. But what I would say to you is that any financial debate must simply be a consequence of the value that our society places in our NHS. So the debate that we need to have needs to be around values and value. The real issue for those of us up here is the immeasurable value of living in a society where you, your family, your neighbors, your friends can all receive high-quality, modern healthcare without having to worry about money at a time when they're already anxious, frightened, or in pain. So at this point, I'd like to hand over to Simon Stevens, the Chief Executive of NHS England, who will present to you some of the fantastic opportunities that are right within our grasp. Thanks very much.
Thanks very much, Bruce. Today, the NHS is coming together to set out an optimistic new direction for health and care in this country, keeping all that's great about the health service, so there for families at times that matter most, when our children are born, when our relatives are sick or frail, and all the years in between, but also explaining how we can get to an even better place as a nation, both in terms of health and in terms of care. The NHS has come a huge distance. We've got a far better health service now than we had 5 years ago, 10 years ago, or even 15 years ago, despite the huge pressures. Treatments have improved. Cancer patients now, most cancer patients survive for more than 10 years, whereas 40 years ago, it was 1 year. Early deaths from heart attacks and strokes are way down by 40% compared with 10 or 15 years ago. And waits for hip operations or cataracts or other routine surgery that used to take up to 2 years, now the average wait is under 10 weeks. So the health service works, and it has come on a huge distance. But there's a lot more that we can do for the reasons that Bruce just set out, and we know what needs to be done as a health service, and we're determined to do it. We've got a growing country. The estimate is that 3 or 4 million more people will be living in England by the end of the decade than they are now, And this morning we're here in Newham in East London, a growing part of the capital, where you can see that growth right before your very eyes. We're an ageing country, we're living longer, and that's a good thing. But the consequence is we've now got more people who are of retirement age than of children, and more long-term health conditions rather than problems that just need a quick fix. And yes, services are under pressure across the National Health Service. GPs are working incredibly hard. More people are needing to go to A&E departments. Staff are pulling out all the stops. So today we're making our case for the NHS to the nation about what the next 5 years could look like. Our argument is that we've got to make progress on 3 fronts. We've got to get much more serious about preventing illness in the first place, taking our own health seriously, both as individuals, families, and as a country. Second, we've got to change the way in which services are being provided to recognise the changing needs of our patients. And third, yes, we do ask the next government to commit to support us in that journey to sustain the comprehensive, needs-based, compassionate health service that the people of this country want. So, improving our health. As a nation, we are getting healthier overall, but there are some significant threats. We know that smoking, 1 in 5 of us, is the single biggest killer still. We know that on an average night in a city like London, perhaps 400, 500 people are admitted to hospital having drunk too much. Alcohol remains a huge health risk. We know that obesity is a growing problem. When our children start primary school, 1 in 10 is obese when they start in reception year. At the point children get to year 6, 1 in 5 has become obese. So something's going wrong in terms of the health and the support that we're giving our kids in primary school. I know this as a dad myself. It's a constant battle to explain to your children why the fizzy drink or the juice with the meal is not the right choice. But it's not just the responsibilities that we as parents have. There are much broader range of actions we're going to need. We've got to keep junk food out of schools, out of hospitals. We've got to change the way food is presented in this country. And so there's a broad health campaign that we need to take much more seriously, because the fact is that if we keep piling on the pounds around our waistline, we're going to be piling on the pounds in future taxes that we're going to have to spend on the health service for entirely avoidable illness. So we've got to get serious about health. That's the first point. The second point is that we're going to have to change the way the health service provides care for patients at the time they need it. And the good news is there's actually a real consensus across the health service about what that would look like and why it's needed. And so it's already happening in many parts of the country. We just need to accelerate that so that it's happening everywhere, recognising that what the health service would look like in different parts of the country inevitably will be different if you're living in a rural area compared with a city or a town. So here at the health centre that we are meeting in this morning, on the site of the Olympic Village in East London, we remember 2 years ago when Danny Boyle opening ceremony celebrated the National Health Service and its history. What we're doing today is saying, that's great, but we look forward. And a better future is happening right now, here on the Olympic site at this surgery. You've got GPs, you've got community nurses, you've got therapists, you've got specialists from the local hospitals, the Homerton Hospital, Barts Hospital, Moorfields, all coming together with community organisations to provide a range of health services so that the young mums that I was talking to earlier this morning are not having to travel to lots of different places around London, being passed from pillar to post, but the services are being organised around their needs and the needs of their children. We also know that there's a huge opportunity to do better on some of the big killers and health conditions that the health service has to treat. Cancer services have improved dramatically in this country, but 1 in 3 of us will have cancer at some point in our life, and it's still the case that 1/4 of cancer patients only get their cancer diagnosed when they turn up and are seen in an A&E department. So we've got to do much better at early detection of cancer services. And that's one of the things that over the next 5 years we are going to be putting huge effort, moving heaven and earth across the health service to do, because we know that as a result, we could save probably more than 8,000 people's lives each year as a result of earlier cancer diagnosis. And we know we've got a huge opportunity to continue to innovate. The National Health Service is one of the world's most innovative health systems. We've got a proud history of British science going all the way back to the discovery of the circulation of blood through to the discovery of the double helix in DNA. We're the country that invented modern nursing, hip replacements, IVF, CT scans, vaccinations, and we've got huge and exciting opportunities in front of us. Tish, who works with me and has diabetes, uses her iPhone to monitor her blood sugar levels. There's more computing power on this iPhone than there was in the hospital that I first started working in the NHS in 1988. So we've come a huge way. We've got great opportunities to harness these new technologies and really transform the way care is provided. So yes, the first piece is we need to get healthier as a nation. The second is we need to change our services. The third piece is we need the support of the next government, not just in funding, but for the changes that we want to make. And it is our shared conviction that with those three pieces in place, the future of the health service can be far better, even than the brilliant services that we've got right now, and that a comprehensive tax-funded national health service of the sort that the nation clearly wants remains entirely doable, even despite the difficult economic circumstances that continue to face this country. So with that, I'm now going to ask Professor Mike Richards. Mike is one of the country's top cancer specialists and also the Chief Inspector at the Care Quality Commission to talk a bit about how we're going to continue to raise care standards across the National Health Service over this next 5 years. So Mike.
Simon, thank you very much. Good morning, ladies and gentlemen. First of all, can I say I welcome this report personally, but also the Care Quality Commission welcomes the report. And as we heard at the meeting earlier this morning, lots of other organisations, and I'm speaking partly on their behalf, they're also welcoming this report. The Care Quality Commission's role is to ensure that all services provided in health and social care are of a high quality. And as many people will know, in the last year we have introduced a radically new approach to inspecting services. We ask 5 questions about any service. Is it safe? Is it effective? Is it caring? Is it responsive to people's needs? And is it well led? And we then give ratings to those as well. And what we've already found is that there are some outstanding services within the NHS. But we've also found some that are inadequate. It is this variation that we see that is frankly unacceptable. But that's why I welcome the emphasis in this report on improving quality, the ambitions that you have set out, and the need for leadership to be supported and developed, because without that we won't see the improvement. I welcome the new models of care that have been set out. We at the Care Quality Commission can adapt our processes to inspect all of these new models of care without any difficulty. We see that as perfectly doable. And then just finally to say that we fully support the commitment for the NHS leadership to be aligned on this. That's absolutely going to be needed. If we're going to drive the improvements and the innovation that we need, we've all got to work together on this, and we will do our part. Thank you.
Thank you, Mike. Now I'm going to ask Jeremy Taylor, who leads National Voices, which is the organisation that brings together many of the country's most significant voluntary organisations and patient groups, to talk about how you see the next 5 years for the NHS.
Well, thank you very much, Simon. We know that good care is personalised, is coordinated, gives people a voice and a say in decisions about their own care and treatment, is safe medically, but also addresses people's wider needs, is holistic. And the growing number of people for whom the answer is not just a medical fix, as you said, Simon, but care and support coordinated across a range of services are not always getting what they really need and deserve. So care is not as personalised and coordinated as it should be. The vision document that you've set out, Simon, I think is fantastic for setting out what good care looks like and capturing that growing consensus of the models of care that give people more say and more control and more coordination. It's fair to say that there have been documents in the past that have made had similar ambitions for patient-centred care, and we haven't made enough progress. So I think if we're going to make progress this time round, then people really have to rally round the vision that you've set out. And that does mean political backing. It does mean a sensible level of funding for the NHS in the future, and also for social care, which you talk about less in the report for understandable reasons, but without the critical social supports, more expenses put onto the NHS and there's more unnecessary suffering. So the funding needs to be right, the political backing needs to be right. I think it's really important that there is collaboration between the NHS, between the voluntary sector, between patients and local communities. The thing that the NHS has struggled most to do is to work in a really collaborative and inclusive way with patients and communities and with voluntary organisations and charities at local and national level. So there's a real opportunity now to kind of to raise the level of the game in terms of really strong collaboration, really ensuring that the NHS is working in genuine partnership with patients, communities. We at National Voices and our members and many of the other voluntary organisations that have helped to provide some input into your exercise are really keen to work with the NHS, national organisations and local organisations to turn that vision into a reality so that in 5 years' time we don't say a lovely vision on patient-centred care, but we haven't actually got very far. I think this time we can and should.
Thank you very much. Let's now turn to Jane Cummings. Jane is the Chief Nursing Officer for England. And Jane, give us a sense of what the staff of the NHS, nurses in particular, are thinking about the next 5 years.
Well, I think this report gives a fantastic opportunity for nurses and midwives to do the work that they love to do and do well, even better. So nurses and midwives make up the largest part of the clinical workforce, the largest part of the workforce in the NHS, and through that have the privilege of working with people from birth right the way through life until death, and are there 24 hours a day, 7 days a week. So that does provide a fantastic opportunity for them to work very closely in terms of making every contact count, reflecting and doing the work around improving public health and well-being, enabling people to look after their own long-term conditions, to stay in their own home. So I think that's a really fundamental part that nurses and midwives will see themselves working on as we move forward. The other areas, I think, is actually truly using their skill, their expertise, their knowledge to work with other clinical colleagues and other stakeholders, and more importantly, our patients, to really determine what that evidence-based care should look like, and then helping to provide that care in whatever setting it takes, whether that be in a community setting, potentially in a hospital, or even in patients' own homes. And I think nurses and midwives have got an amazing opportunity to work with colleagues and work with patients to make that a reality, and to show that we can actually make the changes that are set out in this report and the vision that we have been able to identify collectively to deliver that. So I think they will welcome it, I certainly do, and I look forward to working with our clinical professionals to make it a reality.
Great, thank you very much. I think we've got time for 4 or 5 questions, so who wants to kick us off? Hugh Pym? And if you'd just say who you are and where you're from.
Yes, Hugh Pym, BBC News. You talk in the document... Sorry. Hugh Pym, BBC News. You talk in the document about incentives for employers to help employees get fit, lose weight. To what extent will public money be used in that, and indeed in other areas, to, if you like, nudge and incentivise?
Well, you rightly say that there's an opportunity for working age people to also get support around our own health. So firstly, we will try and ensure that the NHS as an employer gets its act together and provides better support for staff. So there are hospitals like Sheffield that are already beginning to do this, and there's quite good evidence, not just from this country but also from elsewhere, that if you put together different ways of supporting people, then it's possible to make a huge impact on health. I know I myself have lost 3 stone on the back of one of these programmes, so I speak from personal experience of exactly this.
But what about NHS money to encourage private sector employers to do their bit to incentivise employees?
Well, I think the first thing we need to do is make sure that we've got models that work here in England. So the NHS, as an ambassador for the kind of healthy workplaces that we want to see, is a good place to start. But there already are a number of private employers who are doing these kinds of initiatives. So I think what we're going to do is convene the leading employers that are doing the most progressive things in this area to learn the lessons, spread best practice, and then answer the question, what kind of incentives or support will be needed to, as a nation, help us shed those excess pounds? Thomas.
If GPs start providing hospital services like diagnostics, x-rays and so on, it might be cheaper, more convenient for patients. But does it not make hospital services more expensive because they still need to be provided for other patients who don't live near a surgery like this? So where's the net gain?
The improvement is obviously for patients. So the woman that I met this morning who's here for her eye appointment that's been provided by Moorfields Hospital, so the eye specialist from Moorfield coming here to Newham in East London so that eye patients aren't having to travel to City Road to get their appointments. That's a win-win. It's a win-win obviously for patients. It's a win-win for the hospital because it means they're not having to expand their site, the original Moorfield site, as they take on more work. There's some estimates that say if we just kept doing what we're doing in the NHS over the next 5 or 6 years, because we're getting older and because there are more people, actually we'd need to build another 20 or 30 hospitals across the country to deal with all of the extra patients who are being admitted. That's actually not what patients want. What they instead want is services that are closer to home, where the whole of the NHS is working together, the left hand knows what the right hand is doing, services are properly personalised and coordinated around those individuals. And the good news is that places like the health centre we're at here today show it can be done.
Romilly Weeks, ITV News. You want the next government to commit to sustaining the NHS. How confident are you that you'll get what you need, and what happens if you don't get the 8 billion?
We believe that the British people want a comprehensive, well-funded national health service. It has served us well through thick and thin. Obviously, there have been times in the past when funding has been tight and the NHS has continued to provide good quality services. So when we look out over the next 5 years, we know that there's not going to be a return to the high levels of spending that there were during the boom times, but we do believe that the modest extra funding that will be required in order to deliver the sorts of improvements that the nurses, the doctors, our patients want, that is a viable choice for the country over the next 5 years. Obviously, in a tax-funded health service, those are rightly decisions for the elected government, and the British people will, that's a conversation that will be happening with the British people over the next 6 or 7 months.
Richard Vautry, a GP and from the British Medical Association. We're in a wonderful health centre here, something that many GPs would envy, but in reality was only built because the Olympics arrived on their doorstep. An estimate in London alone was that it would cost £1 billion to rectify the premises estate, and that is essential if your vision of moving more care into the community is to be delivered. Are you committed to investing not only £1 billion in London, but potentially £4 billion across the country to ensure that that vision can be turned into reality?
Well, the good news is that actually the NHS is sitting on lots of unused buildings and land around the country, and that's been estimated to be worth up to £7.5 billion. So one of the things we've got to do over the next 5 years is take the money that is locked up in those old buildings or premises and reinvest it in the kind of modern services that we're seeing here now. That will be part of the answer. It won't be the whole answer, but I think there's a lot that the NHS itself can do to kickstart the kind of fantastic modern services that we see here this morning.
Sam Everington, GP at Bromley by Bow in Tower Hamlets. The problem of obesity, 1 in 10 children at the age of 5 in our area, and that's doubled by the end of primary school. We're trying to develop sort of dashboards for head teachers and parents, which will enable them all to see how healthy their children are in schools. My big question on this, seeing as I only see a patient maybe for 10 minutes every year, a child, school sees them for hours every day. What are you and we going to ask schools and the Department of Education to do to help us in the project that you defined today?
Yes. So schools are obviously crucial in this. There's a lot of expectation on schools. Having just been at the PTA evening of my one of my children's primary school, I know that they've got an awful lot to cope with as it is. But the fact is that we've got to do a better job of helping children during the primary school years. School nurses are part of that, but there are some broader changes as well. Some of the councils in this part of London have been trying to ensure that, for example, junk food outlets don't set up right opposite the school entrances. That will help. There's no single answer that's going to sort this, but across the board, we know that we can deal with this problem because it's a problem we didn't used to have. So there's nothing inevitable about it. If as a nation we were able to wind the clock back to how healthy we were in the early 90s, we would prevent 5 million cases of illness each year happening right now at a cost of over £1 billion. So we know it can be done. We've got to now collectively pull together to do it. And Kieran.
Change is hard. We love the focus on prevention and on diagnosis and on treatment, but what can be done to support the staff who are working very hard, putting in long hours, and then have to do this change as well, so that they, on the ground, but also their leaders, are able to manage quite a tricky change, some of which won't always be welcome by people, in a particular community or a particular institution?
Well, talking to nurses and doctors here this morning, there is a clear sense that working in these new ways is actually much easier because it means that they're able to provide the kind of care for their patients that they came into nursing or came into medicine or came into physiotherapy to do. So I think that actually most NHS staff are up for change. If anything, there's a sense sometimes that they're providing care despite the system, not because of it. So they are going to be, together with the communities, the patient groups across the country, the source of energy that's actually going to drive the improvement we want to see, as against, in any sense, standing in the way of it, I believe. On which note, I think we need to call time. So thank you all very much for joining us this morning, and thank you for your continued partnership with us as we take this agenda forward. Thank you.